Hello, I'm Dr. Marie Azizian, founder of Mindful Medical Functional Clinic. This video is to tell you a little bit about our clinic and myself and answer some common questions. But first, I would like to start by describing to you our typical composite patient. Let's call her Jessica. Jessica came to our clinic feeling exhausted. She had been to multiple doctors, had all the standard labs, CT scans, and everything was normal. But she didn't feel normal. She had no energy. Her brain was foggy. She felt bloated all the time and couldn't sleep through the night. Still, she was told, there is nothing wrong with you. And that's exactly the kind of person that we see at our clinic. In general, there are two groups of people that turn to functional medicine. First group is people like Jessica who feel unwell, while traditional medicine says everything looks fine. The medical issue that they're having may not even register via traditional labs, but the issue is there, and the issue is organ dysfunction. Unfortunately, conventional medicine often misses the mark there. The second large group is for people living with chronic medical conditions who are on many medications and seeing multiple doctors. Then one day they wake up, they're ready to take control, and they're finally ready to truly get better. They want to make real and drastic positive changes in their health. That is actually not to say that conventional medicine is bad. It's not bad. It does save lives. Yet the solution to the problem is usually a pharmaceutical, a medication, or surgery. And they do help, but often they come with their own side effects and new medical problems. So functional medicine is not an alternative medicine. It is medicine that is complementary to conventional medicine. It is actually a forgotten whole body approach that was practiced in the past. Functional medicine asks, why is the body not functioning properly, and how can we restore balance and health? It is for people who want to live well and live longer feeling great. So let's start with commonly asked questions. What conditions does functional medicine treat? We don't treat isolated organs. We treat people. If you come in with a migraine, for example, I may start by looking at your gut. Why? Because when we heal your gut, the migraines may improve, and so might your energy, mental clarity, digestion, and even your mood. And that's what happens when you treat the root cause. At our clinic, we help patients with a wide range of conditions like IBS, immune issues, fatigue, skin rashes, brain fog, anxiety, hormonal imbalances, thyroid problems, migraines, food sensitivities, joint pain, fibromyalgia, mood swings, sleep disturbances, and the list goes on and on. Is functional medicine an alternative medicine? No, I already answered that it's not. Functional medicine is based on science, physiology, and research. We use evidence-based tools, nutrition, supplements, lifestyle modifications, and sometimes, yes, pharmaceuticals to help the body function better. As someone who is trained as a surgeon, I've spent years practicing conventional medicine, and I love many parts of it, and I love surgery. But functional medicine gives me the tools to address the why behind the symptoms. So functional medicine is preventative and complementary to the current conventional medicine. And I believe that together they can make a powerful combination. Many people ask, why do most functional medicine workups start with the gut? Because 60 to 70% of your immune system lives in your gut. And your gut is connected to nearly everything. Immune issues like lupus, MS, neurologic conditions like Parkinson's, Alzheimer's, mood disorders like anxiety and depression, metabolic issues like diabetes, skin conditions like eczema, hives, or acne, and of course, digestive problems. Not every case starts with the gut, but many do. And when we treat it, so many symptoms improve. Next. Is testing all there is to functional medicine? No. Testing is just one piece of the puzzle. Functional medicine starts with relationship and context. And that's why your first visit is a full 60-minute consultation with me. We go deep into your history, diet, sleep patterns, stress, your physical activity, emotions. It's like having a doctor and a health coach in one. When we do run tests, we interpret them in context and we act on them. The result? A personalized protocol that includes supplements, lifestyle changes, and yes, again, sometimes pharmaceuticals tailored just for you. Who is a functional medicine provider? Functional medicine providers are doctors and clinicians who realize that traditional medicine doesn't fully explain the body's complex chronic symptoms. And that was me. As a surgeon, I often saw organs that were failing, ruptured, inflamed, perforated. And at some point, I realized that I wanted to help people before it got to that point. That's why I founded Mindful Medical Functional Clinic, to actually focus on prevention, root cause healing, and long-term wellness. But not all providers are equally trained. I'm honored to be certified through the Institute for Functional Medicine, which included intensive science-based training in gut health, immune function, hormones, detox pathways, cardiovascular health, and more. A few words about myself. I am a board-certified general surgeon as well as a certified functional medicine physician. And I have always had a lot of interest in skin health as well, and I founded Mindful Medical Care, a skin disease and cancer clinic, in 2015 in Cape Cod. And I'm also the author of 2 books, The Clear Skin Diet, and it's about the link between food sensitivities and skin health, and also Gallbladder Disease Easily Explained by a Surgeon. And I'm currently working on my 3rd book. Also, because I am a lifelong learner and an educator, I created a YouTube channel, Dr. Marie Azizian, to share educational content on skin health, supplements, surgery, functional medicine, and the latest medical research. I'm also very happy to have completed a certification in functional dermatology through training with a brilliant and renowned naturopathic doctor, Dr. Julie Greenberg. And this additional training has been very helpful in addressing chronic, stubborn skin issues. So enough about me, moving on to the next question. How do I get started, and what does the process at the functional clinic look like? Getting started is actually simple. You begin by scheduling a free 15-minute discovery call with me, and that's our chance to see if functional medicine and our approach is the right fit for you. If you decide to move forward, we book a 60-minute initial consultation where I take a deep dive into your full health history system by system and review any prior labs or imaging you've had. Next, we usually order specialized functional testing to uncover what conventional testing may have missed. Once your results are back, we meet again for another 60-minute test interpretation visit. I explain the findings in plain language and walk you through a personalized treatment plan. And from there, follow-up visits are typically 30 minutes and scheduled based on your needs every few weeks or every few months. Follow-ups aren't mandatory, but they are encouraged to help you stay on track and adjust your protocol as needed. Also, I deeply value collaboration. With your permission, of course, I'm happy to coordinate your care with your existing doctors, especially when it comes to reviewing medications, lab results, or supplements, so that everything works together to support your health. Next, in terms of geography, we are located in Cape Cod, specifically in Falmouth, Massachusetts. We offer both in-person and virtual visits. So if you're local or planning to visit our beautiful Cape Cod, I'd love to see you in person. Our address is on the website, and our phone number is 508-444-6989. For telemedicine visits, I'm licensed to see residents of Massachusetts, California, New Hampshire, and Vermont. Due to a lot of interest from our California patients soon, we will also be starting to offer in-person visits in Glendale, California on bi-monthly basis. I want to focus on the next question. Will I be cured of all my issues if I sign up for this? There is never a promise of cure, especially not for complex chronic issues. That said, we often do see major improvements and complete resolution of certain symptoms. But healing depends on 2 things: the nature of your condition and your level of commitment. Functional medicine is a partnership. Your success depends on how closely you follow the protocol, make changes, and stay engaged in the process. Next, is my personal information safe? Absolutely. All communication takes place through Healthy, our secure HIPAA-compliant platform. Once you sign up for a visit or package, you'll receive access to your private portal where you'll complete consents and medical intake forms. And as I always say, please do not send any medical information through regular email. Next, are our services covered by insurance? We provide super bills for consultations, which you can submit to your insurance for possible reimbursement. However, reimbursement is not guaranteed. We do not accept insurance directly, and most tests are not covered. The one exception is our gut test program, which is often partially covered for Medicare patients, and our pricing reflects that. You'll find more details on pricing for consultations, programs, and test packages in our How to Get Started page on the website. Welcome to Mindful Medical Functional Clinic. I'm looking forward to meeting you.